Well, my name's Dr Shy Mashru. I'm a consultant psychiatrist, and my main area of expertise is adult ADHD. I work at private therapy clinic doing private assessments and management of patients with adult ADHD or suspected ADHD. And I'm also the medical lead for adult ADHD services in the NHS. And so I have a good experience and idea of how both sectors work, both in the public sector and the private sector, and how those two pathways come together at the end, or they can come together at the end. When a patient initially comes to see me, we will have sent you, as a patient, some pre-assessment forms. These will be asking about frequency of typical ADHD symptoms. We will also ask about how those symptoms impact on your life in terms of how they might impact on education, on employment, on relationships, and on sleep, to get an idea about how much this is affecting your life and what areas you want to work with and want improvement in, really. We will also give you an informant report. And this is to be given to someone, perhaps your partner or a family member or a close friend, someone who's known you for a long period of time. ADHD is a condition that would have affected you your whole life, and so it's good to get a good idea of your symptoms from childhood as well as adulthood and how those symptoms have progressed. You will then be booked to see me. That will be for a 90-minute assessment. Where we'll go into a lot of detail, really exploring those symptoms and what you're currently suffering from, what you've previously been suffering from, and how it's impacting on your life in general. I will then also do a general psychiatric history. This is because ADHD doesn't often sit on its own. If you're a patient with ADHD, well, 70 to 80% of you will also be suffering from anxiety and depression. Many of you will have been put on antidepressants, which simply have not really worked because the chemical imbalance that's happening in ADHD is different to what those antidepressants correct. We will then discuss your diagnosis in detail, and I will give you a detailed diagnostic assessment report afterwards. I would also ask your permission to send one of these diagnostic assessment reports to your GP. This is a particularly important part of the process if in the future you would like your management to continue with the NHS with your GP. I would then ask you to complete some investigations, such as blood tests, an ECG, which is a tracing of your heart, as well as your pulse, blood pressure and weight, in preparation to beginning ADHD medication. As an adjunct to ADHD medication, I would strongly recommend ADHD coaching. There are some excellent ADHD coaches at private therapy clinic, and this is a very useful adjunct to medication in providing you some longer-term insight in how to manage your symptoms. I would be in charge of your ADHD medication as your psychiatrist, and so after those investigations, such as the blood tests, have come through, provided that they're all normal, I would then book a follow-up appointment with you, which would be 30 minutes long, and I would talk in detail about all the different medication options that are available to you, and we would come together with a plan to what would suit you the most and your life. We would then begin medication and continue follow-up appointments until your medication plan is optimized. The reason why this requires follow-up appointments is because everyone responds to medication differently, and so we need to find the right medication that's tailored to you and your symptoms. Once we reach your optimal medication plan, the plan then would be to try and transfer your care to the NHS. This is done by something called a shared care agreement. A shared care agreement is a contract, essentially, that's made between myself as your specialist, your psychiatrist, and your general practitioner, your family doctor. This would mean that if your GP agreed to sign the shared care agreement, they would continue your repeat prescriptions on the NHS, and you would be reviewed by myself every 6 to 12 months. This will allow an avenue for you and your GP to be able to contact a specialist, i.e. myself, as part of the shared care agreement. And as part of the shared care agreement, you would be reviewed every 6 to 12 months to ensure that the medication is still optimal for you. I would really encourage anyone who suspects that they have ADHD to come and be assessed sooner rather than later. ADHD has a massive impact on people's lives. It can really affect people in the younger stages in terms of their education. It can have huge effects on employment and people's careers. It impacts people's relationships with others. It can affect sleep, and it can also lead to impulsive symptoms such as spending money very impulsively. ADHD also has a huge component in adulthood in terms of emotions, particularly causing emotions that can go up and down. And 70 to 80% of patients develop low mood and anxiety. So I would really encourage everyone who does suspect that they have ADHD to be assessed and managed promptly, because it can be really life-changing.